Hello everyone and welcome to another video about health. The spine is, without a doubt, one of the most fascinating and complex structures in the human body. Since the evolution of the first hominids who began to adopt an upright posture, it has undergone drastic changes to adapt to the new demands imposed by bipedalism. Composed of 33 vertebrae interspersed by cartilaginous discs and supported by an intricate network of muscles, ligaments, and nerves, the spine not only allows mobility of the trunk, but also protects one of the most crucial parts of the nervous system, the spinal cord. However, although the spine has adapted impressively to the bipedal posture, it was not designed to deal with many of the challenges imposed by modern life, in which sedentary lifestyle, poor posture, and physical overload are common. Spinal problems, such as low back pain, herniated discs, scoliosis, and kyphosis, are among the most common complaints in medical consultations and affect millions of people around the world. The causes of these problems are many and can range from genetic to behavioral factors, such as a sedentary lifestyle, poor postural habits, obesity, and even emotional stress. A deeper look at sedentary lifestyle reveals that it is not just a consequence of modern life, but a central factor in the development of spinal problems. Sedentary lifestyle is directly related to today's lifestyle, where people spend hours in front of computers, watching television, or using mobile devices. Although the human body evolved to move, the technological era has brought a radical change in people's habits, resulting in prolonged periods of inactivity. To understand the impact of sedentary lifestyle on the spine, it is essential to understand the role of the muscles that support this structure. The spine, by itself, does not have the capacity to support the body without the help of a series of muscles that work together to maintain balance and posture. The abdominal, lumbar, gluteal, and hip muscles are primarily responsible for stabilizing the spine. When these muscles are not sufficiently worked or strengthened, as happens in sedentary individuals, the spine is forced to support a greater load than it should, resulting in structural problems. Sedentary lifestyle affects the spine in several ways. Lack of regular movement causes muscles to become weak and atrophied, reducing their ability to effectively support the spine. This results in poor posture, in which the body bends forward or backward, increasing pressure on the intervertebral discs. The intervertebral discs, which are cartilaginous structures located between the vertebrae, act as shock absorbers, distributing pressure and absorbing the impacts that occur during movement. When posture is poor, these discs are compressed unevenly, which can result in disc protrusions or hernias. Another important factor to consider is the influence of a sedentary lifestyle on blood circulation. Lack of movement prevents blood from circulating properly through the muscles and joints, which reduces the amount of nutrients and oxygen that reach the tissues of the spine. This directly affects the ability of the intervertebral discs to regenerate and stay hydrated. When the discs lose their hydration, they become more susceptible to injury and degeneration, aggravating spinal problems. Furthermore, lack of physical exercise affects the flexibility of joints and muscles. Muscle stiffness is one of the main consequences of a sedentary lifestyle and contributes significantly to the onset of back pain. Stiff muscles cannot stretch properly, which reduces the range of motion of the joints and forces the spine to compensate for the lack of mobility. This can result in misalignment of the vertebrae and muscle contractures, which are areas of extreme tension in the muscles, often caused by lack of physical activity. However, the negative effects of a sedentary lifestyle on the spine are not limited to the physical structure alone. Inactivity also affects the functioning of the nervous system, mainly through the reduction of proprioception. Proprioception is the body's ability to perceive its position in space and automatically adjust posture to maintain balance and avoid injury. When a person remains inactive for long periods, proprioception is compromised, making it more difficult for the body to perceive when it is adopting an inadequate posture. This results in a greater likelihood of maintaining incorrect postures throughout the day, aggravating spinal problems. Furthermore, a sedentary lifestyle affects the mind as much as the body. Studies show that physical inactivity is associated with increased levels of stress and depression, which in turn have a negative impact on posture. People who are under emotional or mental stress tend to adopt defensive postures, such as hunching their shoulders forward and tilting their head downward, which increases pressure on the cervical and thoracic spine. This vicious cycle of emotional and physical stress contributes to the development of chronic pain and musculoskeletal disorders. Another important aspect to mention is the impact of a sedentary lifestyle on specific populations, such as children and the elderly. The number of sedentary children has increased dramatically in recent decades due to the excessive time spent on passive activities, such as using electronic devices. This sedentary behavior, combined with heavy backpacks and poor posture in classrooms, is contributing to the early development of spinal problems, such as scoliosis and low back pain. On the other hand, older people, who naturally lose muscle mass and bone density as they age, are particularly vulnerable to the effects of a sedentary lifestyle. Prolonged inactivity can accelerate the degeneration. Os maus habitos posturais desempenham papal central no desenvolvimento de problemas na coluna vertebral. A postura inadequada ao longo do tempo pode causar uma série de complicações musculoesqueléticas, resultando em dores crônicas, lesões e degenerações estruturais. No entanto, muitos indivíduos não têm consciência de que suas rotinas diárias estão repletas de comportamentos que contribuem diretamente para essas condições. Desde a maneira como nos sentamos em uma cadeira e como dormimos, pequenas decisões posturais podem ter impacto significativo na saúde da coluna a longo prazo. Para começar, a postura sentada é dos maiores velos quando se trata de problemas posturais. Muitas pessoas passam grande parte do seu dia sentadas, seja no ambiente de trabalho, em casa ou no transporte. A má postura sentada é extremamente comum e envolve comportamentos como curvar-se para frente, apoiar-se excessivamente em dos lados ou deixar os ombros cair. Esse tipo de postura sobrecarrega as vértebras lombares, comprimindo os discos intervertebrais e provocando dores na região inferior das costas. Dos problemas mais frequentes relacionados à postura inadequada ao sentar é a lordose exagerada, quando a curvatura natural da lombar é acentuada, o que aumenta a pressão nos discos. Essa pressão não só pode causar dores imediatas, mas também contribuir para o desgaste precoce dos discos intervertebrais. Quando os discos se desgastam, eles perdem sua capacidade de amortecer os impactos e podem comprimir as raízes nervosas que saem da medula espinal, o que leva a sintomas como formigamento, fraqueza muscular e dores irradiadas para as pernas e bracos. Isso é frequentemente visto em condições como a hernia de disco, problema comum em pessoas que mantêm uma postura inadequada ao sentar por longos períodos. A postura de pé também é uma fonte de problemas posturais se não for executada corretamente. Ficar de pé por longos períodos pode causar desconforto se o peso do corpo não estiver distribuído de forma adequada. É comum observar pessoas transferindo seu peso para uma das pernas enquanto relaxam a outra, o que pode causar desalinhamento da coluna e das articulações do quadril. Como tempo, essa postura pode resultar em dores nas costas e nos joelhos, pois o corpo não está equilibrado corretamente. Além disso, o uso de calçados inadequados, como sapatos de salto alto ou sem suporte adequado para o arco do pé, pode intensificar esses problemas, pois forçam o corpo a ajustar sua postura de maneira não natural. Outro mau hábito postural frequentemente ignorado é a postura adaptada ao dormir. Dormir de barriga para baixo, por exemplo, pode forçar o pescoço a ficar em uma posição rotacionada durante horas, o que afeta negativamente a coluna cervical. Dormir de lado sem o apoio adequado para o pescoço ou os quadris também pode resultar em desalinhamentos da coluna. A posição ideal para dormir é de lado, Comum travesero que, sistent acabica, e alinea columna cervical com o restant du corpo. E outro travesero entre os joelhos para manter a columna lombar alinhada. Alum disso. A forma como as pessoas levantam objetos também é fator crucial que muitas vezes é negligenciado. Erguer objetos pesados de maneira inadequada, usando a coluna em vez de as pernas, pode provocar serias lesões, como distensos musculares, e até mesmo fraturas nas vértebras. O ideal é dobrar os joelhos e manter a coluna ereta ao levantar qualquer tipo de carga, transferindo o esforço para os músculos das pernas, que são mais fortes e capazes de suportar o peso. Outro aspecto importante relacionado aos maus hábitos posturais é a falta de ajuste ergonômico nos ambientes de trabalho. A ergonomia tem como objetivo adaptar o ambiente às necessidades físicas do indivíduo, proporcionando uma postura correta e confortável. No entanto, muitas pessoas trabalham em espaços de trabalho inadequadas, com cadeiras que não oferecem suporte suficiente para a lombar. Monitors mal posicionados que forçam o pescoço a ficar inclinado para baixo ou para cima, e mesas que são muito altas ou muito baixas. Todos esses fatores contribuem para o desenvolvimento de dores nas costas, no pescoço e nos ombros. A solução é ajustar o ambiente de trabalho de acordo com os princípios ergonômicos, utilizando cadeiras com apoio lombar, posicionando o monitor na altura dos olhos e garantindo que os braços ficam em um ângulo de 90 graus em relação à mesa. Outro mau hábito comum, principalmente com o uso excessivo de dispositivos móveis, é a postura de pescoço de texto. Essa postura ocorre quando as pessoas inclinam a cabeça para frente e para baixo para olhar para seus smartphones ou tablets. Esse movimento repetido coloca uma pressão imensa sobre a coluna cervical, já que a cabeça humana pesa cerca de 5 a 6 kg, e, quando inclinada para frente, pode exercer uma força de 8 a 27 kg sobre o pescoço. Como tempo, essa postura pode levar a dores crônicas no pescoço, tensos musculares e, em casos mais graves, problemas degenerativos na coluna cervical. É essencial que as pessoas façam pausas regulares ao usar dispositivos móveis e tentem manter os aparelhos na altura dos olhos para reduzir a inclinação de cabeça. Além das posturas adequadas durante o dia, a falta de consciência corporal também contribui para a perpetuação de maus hábitos posturais. Muitas pessoas não estão cientes de que estão adotando posturas inadequadas, pois o corpo se adapta a esses posições ao longo do tempo. Por exemplo, alguém que passa muito tempo cavado para a frente pode não perceber que sua postura está desalinhada e que começa a sentir dor ou desconforto. A falta de percepção corporal é dos principais desafios na correção dos maus hábitos posturais, pois é difícil corrigir algo que não se sabe que está errado. A conscientização corporal é, portanto, passo fundamental para a reeducação postural. Práticas como a yoga, o pilates e o alongamento ajudam a aumentar essa consciência, ensinando as pessoas a perceberem como seus corpos se movem e se alinham no espaço. Por fim, é importante destacar que os maus hábitos posturais não afetam apenas a coluna vertebral, mas todo o sistema musculoesquelético. As articulações, os músculos e os tendos também sofrem as consequências de uma postura inadequada, resultando em dores generalizadas, rigidez e até mesmo problemas crônicos, como tendinites e bursites. A postura correta não apenas alivia a pressão sobre a coluna, mas também melhora a distribuição do peso corporal, reduzindo o esforço necessário para realizar movimentos diários e prevenindo lesões. Em resumo, os maus hábitos posturais estão profundamente enraizados na rotina moderna, e corriqueo desses comportamentos é essential para prevenir problemas na coluna vertebral. A conscientização sobre a postura correta, a adequação de práticas ergonômicas e a implementação de hábitos saudáveis no dia a dia são passos fundamentais para preservar a saúde da coluna e evitar dores e lesões no futuro. Como tempo, essa postura pode levar a dores crônicas no pescoço, tensões musculares e, em casos mais graves, problemas degenerativos na coluna cervical. É essencial que as pessoas façam pausas regulares ao usar dispositivos móveis e tentem manter os aparelhos na altura dos olhos para reduzir a inclinação de cabeça. Além das posturas adequadas durante o dia, a falta de consciência corporal também contribui para a perpetuação de maus hábitos posturais. Muitas pessoas não estão cientes de que estão adotando posturas inadequadas, pois o corpo se adapta a esses posições ao longo do tempo. Por exemplo, alguém que passa muito tempo curvado para a frente pode não perceber que sua postura está desalinhada e que começa a sentir dor ou desconforto. A falta de percepção corporal é dos principais desafios na corriqueo dos maus hábitos posturais, pois é difícil corrigir algo que não se sabe que está errado. A conscientização corporal é, portanto, passo fundamental para a reeducação postural. Práticas como o yoga, o pilates e o alongamento ajudam a aumentar essa consciência, ensinando as pessoas a perceberem como seus corpos se movem e se alinham no espaço. Por fim, é importante destacar que os maus hábitos posturais não afetam apenas a coluna vertebral, mas todo o sistema musculoesquelético. As articulações, os músculos e os tendos também sofrem as consequências de uma postura inadequada, resultando em dores generalizadas, rigidez e até mesmo problemas crônicos, como tendinites e bursites. A postura correta não apenas alivia a pressão sobre a coluna, mas também melhora a distribuição do peso corporal, reduzindo o esforço necessário para realizar movimentos diários e prevenindo lesões. Em resumo, os maus hábitos posturais estão profundamente enraizados na rotina moderna, e a corriqueo desses comportamentos é essencial para prevenir problemas na coluna vertebral. A conscientização sobre a postura correta, a adequação de práticas ergonômicas e a implementação de hábitos saudáveis no dia a dia são passos fundamentais para preservar a saúde da coluna e evitar dores e lesões no futuro. Obesity and being overweight are conditions that have become alarmingly common around the world, affecting millions of people of all ages and backgrounds. This increase in the prevalence of obesity not only impacts overall health, but also has specific and serious consequences for the spine. The extra weight that people carry puts extra pressure on the structure of the spine, leading to a range of problems that can worsen over time. One of the most direct effects of excess weight on the spine is the increased load on the vertebrae and intervertebral discs. The spine is designed to support a specific amount of weight, and when this load exceeds normal limits, additional stress is placed on the joints and muscles that support the spine. This can result in a variety of problems, such as back pain, degeneration of the intervertebral discs, and even herniated discs. The negative impact of excess weight can be especially significant on the lower back, which is already the part of the spine most susceptible to injury due to its function of bearing the majority of the body's weight. Additionally, obesity is often associated with increased inflammation in the body. Studies have shown that body fat, especially visceral fat that accumulates in the abdominal cavity, secretes inflammatory substances that can affect the health of the entire body. This chronic inflammation not only worsens joint and muscle pain, but it can also interfere with the body's ability to recover from injuries. For those who already suffer from back problems, this additional inflammation can make healing and rehabilitation even more difficult, resulting in a vicious cycle of pain and disability. The link between obesity and back problems also extends to psychological and emotional factors. Many people who struggle with obesity face emotional and psychological challenges, including low self-esteem, depression, and anxiety. These factors can lead to a sedentary lifestyle, where the person avoids physical activities that can improve their health and strengthen the muscles that support the spine. A lack of physical activity not only contributes to weight maintenance, but it also results in weakened muscles, which in turn worsens postural problems and increases back pain. Additionally, being overweight can negatively affect the mechanics of the body when walking, running, or performing daily activities. Uneven weight distribution can cause an improper movement pattern, leading to increased stress on the joints of not only the spine, but also the knees, hips, and feet. These altered mechanics can result in injury and pain, creating a situation where the individual finds themselves trapped in a cycle of pain and disability that feeds on the condition of being overweight. Another important aspect to consider is the role of diet in spinal health. Obesity is often the result of an inadequate diet, high in processed foods and refined sugars, which not only contributes to weight gain, but can also lead to nutritional deficiencies. Essential nutrients such as calcium, vitamin D, and magnesium are essential for bone and muscle health. A diet lacking in these nutrients can compromise the strength and integrity of the spine, making it more susceptible to injury and degeneration. Correcting obesity and excess weight is a vital step in improving spinal health. Even modest weight loss can have a significant impact on reducing the strain on the spine, relieving pain, and improving mobility. In addition, weight loss can help reduce inflammation in the body and improve overall health. Combining a balanced diet and a regular exercise program is essential to achieving and maintaining a healthy weight. Low-impact physical activities, such as walking, swimming, and cycling, are particularly beneficial as they help to strengthen the muscles that support the spine, improving posture and reducing the risk of injury. It is crucial that any weight loss plan is approached holistically, considering not only diet and exercise, but also mental and emotional health. Psychological support can be essential in helping people cope with the challenges that come with obesity and stay motivated on their weight loss journey. In addition, professional support from nutritionists and physiotherapists can provide personalized and practical guidance for effective dietary and postural re-education. In conclusion, obesity and being overweight have a significant impact on the health of the spine. The extra load, associated inflammation, and poor body mechanics are all contributing factors to a range of problems, from back pain to chronic injuries. Promoting a healthy lifestyle, including a balanced diet and regular physical activity, is essential for maintaining spinal health and preventing future problems. Postural re-education should be integrated into this process, helping individuals develop greater body awareness and adopt habits that promote long-term spinal health. A sedentary lifestyle is one of the main public health concerns today, being recognized as one of the most significant risk factors for a variety of health problems, including cardiovascular disease, type 2 diabetes, obesity, and, of course, orthopedic problems, particularly those related to the spine. Modern life, characterized by long hours in front of screens, whether at work, at home, or during leisure, has contributed to the increase in sedentary lifestyles among different age groups. This phenomenon has alarming consequences for the health of the spine, affecting not only the bone structure, but also the supporting muscles and the general posture of the body. One of the main impacts of a sedentary lifestyle on the spine is the weakening of the muscles that support the region, such as the core muscles, which include the abdominal, lumbar, and hip muscles. These muscles are essential for maintaining good posture and supporting the loads that the spine faces daily. When these muscles are not used or challenged, they become weak and ineffective, leading to poor posture and, consequently, back pain and other related problems. Muscle weakness can also result in increased compression on the intervertebral discs, increasing the risk of injuries such as herniated discs. In addition, lack of physical activity affects the flexibility and overall mobility of the body. The muscles and ligaments that surround the spine need to be stretched and strengthened to maintain good health. Without regular exercise, flexibility decreases, making the muscles more prone to injury and strain. This stiffness can make it difficult to perform everyday movements and limit the individual's ability to participate in activities that require agility and coordination, resulting in an increasingly sedentary lifestyle. A sedentary lifestyle is also directly linked to poor posture, which can lead to a number of spinal problems. Many people adopt poor postures when sitting, especially in work environments that are not ergonomically suitable. Spending long hours sitting in chairs that do not provide adequate support can lead to overstressing of the spinal structures, resulting in pain and discomfort. This excessive pressure on the joints and discs can lead to injuries, such as degeneration of the intervertebral discs, which can result in chronic pain and even disability. The effects of a sedentary lifestyle are not limited to the workplace. They also extend to the home and leisure areas. The increased use of electronic devices, such as smartphones and tablets, has contributed to an increase in physical inactivity. The postures often adopted when using these devices, such as leaning forward or hunching the spine, can further exacerbate postural problems, resulting in neck and back pain. The combination of poor posture and lack of physical activity creates an environment conducive to the development of chronic pain syndromes, which can be difficult to treat. In addition to the physical effects, a sedentary lifestyle can also have a significant impact on mental and emotional health. Studies show that regular physical activity is associated with improved mental health, including reduced levels of stress, anxiety, and depression. When people become sedentary, they miss out on the mental health benefits that physical activity provides, which can lead to a vicious cycle of inactivity and emotional distress. This connection between physical and mental health is crucial, especially for those who already deal with chronic back pain or other spinal issues. Pain can increase stress and anxiety levels, leading people to further avoid physical activity, which can worsen the problem. To reverse the effects of a sedentary lifestyle on the spine, it is essential to implement lifestyle changes that promote greater physical activity. Incorporating regular exercise into your daily routine not only strengthens the muscles that support your spine, but also improves flexibility, mobility, and posture. It is recommended that people aim to get at least 150 minutes of moderate-intensity physical activity per week, which can include walking, swimming, cycling, or strength training. Additionally, specific exercises that focus on strengthening the core and improving posture, such as yoga and Pilates, can be especially beneficial. Taking active breaks throughout the day is also essential, especially for those who spend long hours sitting. Getting up to stretch, walk around, or do some light strengthening exercises every hour can make a big difference to your spine health. By taking a proactive approach to spinal health, you can significantly reduce the prevalence of sedentary lifestyle-related problems and promote a healthier, more active lifestyle. In conclusion, a sedentary lifestyle poses a significant risk to spinal health, contributing to muscle weakness, stiffness, and poor posture. Promoting an active lifestyle that includes regular exercise and awareness of proper posture is key to preventing and treating spinal problems. By effectively addressing sedentary lifestyles, you can improve your quality of life and overall health. Spinal injuries and trauma are significant causes of pain and dysfunction for many people, spanning a wide range of situations, from road traffic accidents to falls and sports injuries. These events can result in direct damage to the structure of the spine, affecting the vertebrae, intervertebral discs, and the soft tissues that surround them. The severity and nature of the injuries vary widely, but all have the potential to cause severe pain and compromise normal spinal function, leading to a significant impact on an individual's quality of life. Road traffic accidents are one of the most common causes of spinal injuries. The force of an impact can cause sudden movements that result in injuries, such as whiplash syndrome, which occurs when the head is suddenly thrown forward and backward. This injury can damage muscles, ligaments, and even joints in the cervical spine, resulting in pain and stiffness. In addition, severe impacts can cause vertebral fractures, dislocations, and intervertebral disc injuries, which require medical intervention and extensive rehabilitation. Falls also pose a significant risk to the spine, especially in older populations. Bone fragility, which often accompanies aging, increases the risk of fractures in the event of a fall, even if the height of the fall is low. Vertebral fractures can result in acute pain, deformity, and loss of mobility. In addition, fear of falling again can lead to a sedentary lifestyle, exacerbating general health problems and increasing vulnerability to future injuries. Sports injuries are another important consideration. Activities that involve sudden movements, such as football, basketball, gymnastics, and weightlifting, can result in spinal injuries. Lifting heavy loads without proper technique can strain the muscles and ligaments that support the spine, resulting in strains and pain. In addition, collisions in contact sports can cause direct injuries to the spine, leading to significant damage that may require surgical intervention or prolonged rehabilitation. Trauma is not limited to acute events. Chronic injuries, such as those caused by poor posture during daily activities or repetitive motions, also play a significant role in spinal problems. Repetitive lifting of heavy objects without proper technique can lead to cumulative injuries over time, resulting in degeneration of the intervertebral discs and chronic pain. Similarly, working in an awkward position, such as sitting in an unsupported chair or leaning excessively over a desk, can create additional stress on the spine, leading to posture problems and pain. Damage to the spine can be not only physical, but also emotional. Chronic pain resulting from spinal injuries can impact an individual's mental health, leading to feelings of frustration, depression, and anxiety. The inability to participate in activities that were once enjoyable can lead to social isolation and a decreased quality of life. It is essential to consider this emotional dimension when approaching the treatment of spinal injuries, ensuring that the individual receives the necessary support to deal with the emotional consequences of pain. Proper rehabilitation after a spinal trauma or injury is essential for recovery and the prevention of future complications. Treatment may include physical therapy, which aims to strengthen the muscles that support the spine, improve flexibility, and restore normal function. A physical therapist can develop an individualized plan that addresses the patient's specific needs and helps them regain strength and mobility. The use of manual therapy techniques, strengthening and stretching exercises, and teaching injury prevention strategies are essential components of this process. In addition to physical therapy, additional medical interventions may be necessary, depending on the severity of the injury. In cases of vertebral fractures or herniated discs, treatment may include pain medications, corticosteroid injections, and, in more severe cases, surgery. The choice of treatment should be made jointly by the patient and the medical team, taking into account the individual needs and severity of the injury. Patient education also plays a crucial role in preventing future spinal injuries. Teaching proper lifting techniques, correct posture, and the importance of taking breaks during prolonged activities can help reduce the risk of re-injury. Additionally, raising awareness of the importance of muscle strengthening and flexibility can motivate individuals to maintain an active and healthy lifestyle, promoting long-term spinal health. In summary, trauma and injuries are significant causes of spinal problems and can result from accidents, falls, sports injuries, or cumulative damage. The impact of these injuries can be profound, affecting not only the physical health, but also the mental and emotional health of the individual. Proper rehabilitation, along with patient education, is essential for recovery and prevention of future complications. By taking a comprehensive approach that considers both the physical and emotional aspects, it is possible to promote effective recovery and a healthy life, minimizing the risks of spinal injuries. Until a new video, don't forget to leave that wonderful like, share our videos, and invite more friends to participate.